Dimenhydrinate is a type of antihistamine that is used to help prevent and treat nausea, vomiting, and dizziness that can be caused by motion sickness. It's important to note that this medication should not be used in children younger than 2 years old unless specifically directed by a doctor. For those who experience motion sickness, dimenhydrinate can provide relief from the uncomfortable symptoms such as nausea and vomiting. It can be taken at the onset of symptoms or as directed by a healthcare professional. The typical daily dosage will vary based on individual needs, so it's important to follow the instructions provided by your doctor or on the medication label. It's best to take dimenhydrinate as needed, typically before travel or activities that may trigger motion sickness. Make sure to follow all the instructions on the package or as prescribed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication with or without food, and it's best to use a special measuring device or spoon for liquid forms. It's important to chew the tablets thoroughly before swallowing, and the dosage will depend on your age, medical condition, and how you respond to the treatment. Do not take more than directed. For preventing motion sickness, it's recommended to take the first dose 30 to 60 minutes before the activity that may cause it, such as traveling. If your condition doesn't improve or gets worse, be sure to inform your doctor. If you experience drowsiness, constipation, blurred vision, or dry mouth/nose/throat, it's important to let your doctor or pharmacist know. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If your doctor has recommended this medication, it's because they believe that the benefits outweigh the potential side effects. However, it's important to let your doctor know if you experience any serious side effects such as changes in mental or mood, fast/irregular heartbeat, shaking, or difficulty urinating. Seek medical help right away if you experience seizures or signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking dimenhydrinate, it's important to tell your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, an overactive thyroid, or difficulty urinating. This medication may cause drowsiness or blurred vision, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also recommended to avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are using liquid products or chewable tablets, it's important to note that they may contain sugar and/or aspartame. If you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid these substances, be sure to speak with your doctor or pharmacist about using this product safely. It's important to note that children may be more sensitive to the side effects of this drug, and it can often cause excitement in young children instead of drowsiness. As for older adults, they may be more sensitive to the side effects, especially drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this drug can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with motion sickness medication include antihistamines applied to the skin. It's important to tell your doctor or pharmacist if you're taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines, including allergy or cough and cold products, because they may contain ingredients that cause drowsiness. And be sure to ask your pharmacist about using those products safely. It's also important to note that this medication may interfere with certain lab tests, possibly causing false results. Be sure to let lab personnel and all your doctors know that you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and dilated pupils. In children, you may notice mental or mood changes such as restlessness, irritability, or hallucinations before they become drowsy. Always keep an eye on the dosage and seek help if you suspect an overdose. Make sure to attend all scheduled medical appointments and laboratory visits. If you forget to take a dose, take it when you remember. If it's almost time for your next dose, skip the missed one and take the next dose at the regular time. Do not take double the dose to make up for the missed one. When it comes to storing motion sickness medications, it's important to keep them at room temperature and away from moisture and light. Avoid storing them in the bathroom and refrain from freezing liquid forms of the medication. It's also crucial to keep all medications out of reach of children and pets. When it comes to disposing of motion sickness medications, it's important not to flush them down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.